Hi there, Government Property. Today, we're going to talk about psychology and mental health injury. What is a mental health injury? What is psychology? What does this have to do with anything? You know, good questions. Um, so psychology. Psychology is, as just a brief, quick 1,000 mile, 100 mile stare, or whatever. It's a study of human behavior. It is just, why we do what we do, and it's not like it began with the theorists in, like Freud or Wundt or Skinner or, um, you know, Chomsky. Mental health has been looked at for centuries. They just sometimes didn't know what it was, but they looked at it. It's been looked at for centuries. And psychology can be broken down to two areas of study. Positive psychology, which is effectively why successful people are successful over time, why some people can be exposed to traumatic events or to issues and they're able to, like, they just water off a duck's back. It doesn't hurt them, it doesn't affect them, they just keep trucking. That's positive psychology, and it's only in like the last 50 years it's really been studied. It has been looked at, but for the most part it's only really been studied and been looked into in the last 50 years. Negative psychology is disorders. Why that person is acting that way, why that person is acting that way, why this is going on, why that is going on. It's negative psychology. And the vast majority of the research and done into the field of psychology is on negative psychology, mental health disorders, mental health injuries, mental health issues. And this is the brunt of psychological work. Um, if you want to find out, if there's more information on negative psychology, you're going to look into the Diagnostic and Statistic Manual version 5, DSM-5. That's where you can find a whole list of how to diagnose, what it looks like, so forth. And when it comes into specifically, mental health disorders, there isn't any DSM, manual for positive psychology that I know of. Mostly because you don't treat positive psychology. You observe it and you attempt to explain it to people. Um, so mental health disorders. A mental health disorder is a significant, it causes significant distress and dysfunction in the person. And it falls into three primary categories. There are those people who, from a genetic perspective, are born with some kind of neurochemical issue in their head. Um, this can be things like ADHD, dyslexia, schizophrenia, in some cases bipolar, in some cases autism, in some cases various personality disorders. And there is a genetic component, meaning that these individuals are formed in the womb, are born with this disorder. And they're going to have it their entire life, and they're going to need to be treated just like a chronic illness, usually through medication and a little bit of therapy to help them, manage it. Environmental falls under neurochemical and behavioral. Environmental disorders are not genetic, but they can appear to be genetic. What I mean by this is, say your mom was doing large quantities of cocaine or methamphetamines, or drinking, or smoking, or was exposed to some kind of chemical, or was exposed to some kind of viral infection while they were pregnant with you. It's entirely possible that this could have caused something neurochemically. There can also be behavioral issues, like when you're little. If you grew up in a specific culture, if you grew up in a specific set of issues with your parents or your family or your grandparents, socioeconomics can fall into this, where you have a disorder based on what you've learned from your environment, what you've been dealing with. And even though what is it? The research isn't super conclusive when it comes to autism. Is it genetic? Is it caused by something environmental? Is it caused, same thing with certain aspects, certain psychotic disorders like schizophrenia, schizotypical, bipolar. These issues are, there's many different ways they can come about. Then you have mental health injuries. These come from trauma. And it's not environmental, because trauma is something that under normal circumstances you wouldn't normally experience. You're minding your own business, you're walking down the road, somebody runs up and clocks you in the back of the head and steals your stuff. Well, you have a physical injury, and now you've got a mental injury. Why? Because you've you've been traumatized in such a way of going, how do I, I just got attacked. What, why? Start asking dozens of questions, start trying to figure it out. It only becomes a significant issue if it lasts beyond a certain period, usually more than 30 days. Usually if it lasts, it's like prevalent for 60 to 180 days, so up to 6 months. Most of these injuries become disorders after they've gone for a certain amount of time. Case in point, the vast majority of people suffering from post-traumatic stress are due to automotive accidents. You're driving down the road, minding your own business, somebody T-bones you, and the next time you go driving, and you ever watch high-speed chases where the fleeing criminal hits just some random car? Well, that random person driving wasn't doing anything wrong, and now their entire life has been uprooted by somebody else. They're going to suffer the trauma of the loss of their car, probably injuries, likely loss of work. All these things are traumatic. Some people are able to, due to positive psychology, hey, shit happens. It's a terrible thing. I'll recover. I'll be fine. Other people are just like, I can't go driving again. I can't trust that this isn't going to happen again. And there's a difference there, but it is an injury. And at least through my experience, through my research and study, the vast majority of mental health disorders come from injuries. Whether it's being treated poorly, whether it's learned behavioral injuries, behavioral. It can be and you can end up with a combination of either. You can have injuries caused by environmental issues. You can have injuries that are made worse because of a genetic psychological issue. You can have any combination of that, but mental health injuries are almost exclusively caused by trauma. One of the things that I run into especially is a lot of people don't understand, like if you have a physical injury, you break an arm, you break a leg, you have cracked ribs, burns, many of the things that veterans will deal with, amputees, extreme scarring, deep scar, physically deep scars. They had to be sewed up, sutured up. A lot of these things are very visible. People can see them. People go, oh God, you've been hurt, and they'll treat you differently. Usually there's a certain level of empathy, a certain level of, hey, man, it looks like you've been through some stuff. Mental health injuries tend to be very covert, hidden. Most people don't see them. Now, if you see somebody acting out who's schizophrenic or bipolar, you might be able to go, oh, hey, this person's suffering from something, obviously. But depression, phobias, stress, anxiety, post-traumatic stress, adjustment disorder, these things tend to be very personal and very hidden. In fact, most veterans will hide them very well. They'll go about their lives, they'll suffer in silence so that they're able to continue functioning, but they've had to learn what I call maladaptive coping mechanisms. When you go through an injury of any kind, like case in point, you're walking down the road and you're walking in your backyard, you step on a nail. Maybe you weren't wearing shoes, maybe you were wearing shoes, doesn't matter, causes an injury. You're going to be more careful in the yard. You're going to do things to try to make sure that doesn't happen again. Mental health injury is the same thing. You're going to try to avoid being in the situation that caused you harm. And this is usually where the maladaptive coping mechanisms come from, because we're like, hey, I don't want to get hurt again, mentally or physically. I'm not going to put myself in that situation, and so I'm going to cope this way, but it doesn't work. It causes a situation in which, hey, I'm not going out with friends anymore. I'm not going to go out in my backyard because I can't trust there aren't other things that hurt my feet. I'm not going to drive down the road because I might get hit again, etc. And it's really annoying for a person to deal with that, because they'll look at their friends, their neighbors, and go, hey, why are they doing this? Why am I not normal? And so the injury can, in fact, cause more injury, or the coping mechanism can cause more injury. But, how do you treat it? How do you fix it? Well, the treatment of a mental injury is treated very similarly to a physical injury. Say you break your arm. You're going to go to the hospital, the doctor. They're going to set it, put it in a cast, and then you're going to have to sit there and let it heal over time. If you get a really deep cut, gunshot wound, knife, cut. You're at work and somebody drops a piece of concrete and it cuts a hole in your arm or whatever. I had a journeyman electrician I was working with that had that happen to them. Bricklayers on the 6th floor of a building were chucking brick debris down an elevator shaft, caught him in the arm, cut him from his elbow to his wrist. It's going to leave a scar. It's going to be hurt. It's going to cause pain. It's all kinds of stuff. And how do you treat it? Well, first, with anything, you clean the wound. And then you turn around, if it needs stitches, you stitch it up. If it needs skin grafts, you skin graft, so forth. Mental health injuries are the same. You have to come in, and first thing as a therapist, we have to find the wound. Then we have to clean it, which usually means we've got to get in there and disinfect. And this can be painful, but necessary for healing. Then we're going to try to do it. We're going to help you suture it up, stitch it up, cast it up, brace it, and then we're going to help you cope over time with just healing, with just letting it heal. Just like with physical remedies, there is no magic pill that there's no senzu bean that's going to restore you physically or mentally. It just doesn't exist. Thank you, Akira Toriyama. I do give credit to him for that. May he rest in peace. But there is no instant magic cure for mental health injuries or physical health injuries. And when it comes to mental health, it depends on how severe it is and how long it's been untreated. If you break your leg and then you let it heal naturally, which it's been shown animals and various other creatures do, you might walk with a limp the rest of your life because it healed wrong. You might have a scar that you might have a cut that gets infected. Well, now you've got to treat the infection and you've got to treat the original wound. And so with mental health, it's identical. It's the same. You have to come in and you have to work on this. Some people say, what are medications? Well, medications, just like in the physical world, medications for physical injuries are designed to help with the pain, help alleviate or dull the pain, but also help your body heal on its own. Mental health medications are designed to stabilize a condition, in the case of depression, anxiety, suicidal ideation, etc., to stabilize it. In the case of individuals with genetic disorders, these treatments are something you'll be taking the rest of your life. Individuals on ADHD medication may be taking it all their life or may be able to learn the good, healthy coping mechanisms so that they don't have to take it all their life. Now, as a quick disclaimer, if your psychiatrist has prescribed you medication, I'm not going to tell you to I will never tell you to stop taking it. If you want to come off of the medication, I will always tell you to talk to your doctor about that, whether they think it's a good idea, because at the end of the day, I'm not a psychiatrist. I'm not going to tell you how to do your medication. But from the way I've seen it, if you have a mental health injury, and it is an injury, in other words, there's a specific start time from when it occurred, of depression or anxiety. There was a point when you didn't have it and suddenly you have it. Then it's like, okay, the medications to stabilize, and then we come in as a therapist and we treat. It's like pain medications so that you can get through the treatment, and at the end of it, you're able to then heal, recover, move on, and be whole again. I think the biggest issue you run into with this is that more often than not, people get this idea when it comes to psychology that's, I'm going to come in and I'm going to be cured. No. You're going to have a scar, just like with a physical injury. You're going to have a scar your entire life. You're going to remember that event your entire life. However, just like with a scar, if you have a scar and you look at it, it's like, hey, yeah, I got this woodworking, or I got this when I was out hunting, or, when I was a kid, I fell off my bike and tore a hole in my leg. It'll remind you of the event, but the pain's not going to be there. The trauma's not going to be there. It's going to be healed, but it's still going to be a reminder of what happened. And I try to explain that to individuals coming into therapy because there is this mystique of, oh, you can cure us. I can help you heal. I can help you get better. I can help you be the best you can be after the event. If you were a veteran who lost a limb, had an amputation of an arm or a leg, I can't give you your arm or leg back. I can help you move on beyond it. If you're an individual who had a serious traumatic event that damaged you internally, I can help you move on. That event happened. That's reality. I can't change it. But I can help you become better because of it. I can help you get to the other side of that and go, hey, I am better. I am able to function. That's a therapist's job. Sometimes we're able to do it. Sometimes we're not. And I say sometimes we're not because at the end of the day, the therapist is there to help the client, the veteran, the child, the adult, the male, the female, the man, the woman, whatever, process what they're going through and help them through the healing process, just like a doctor does. We can't just come in and magically, mystically make things better. We don't have the ability to step in like a heart surgeon and do a heart transplant. We can't come in and say, oh, this trauma, this loss of, this loss of a loved, this traumatic loss of a loved one, we can't just replace the loved one. We can come in and teach you how to cope, how to grieve, and what's normal, what's not, and help you experience it and move on. But when I say move on, it's not, oh, forget about it and you're all good. You will always remember. But you will be in control. The trauma won't. That's the goal. Hopefully, this has been educational. This has been useful. You know, as a veteran, I want my fellow brothers and sisters to hear this and know, hey, we can help you recover. We can help you find healing. If you like what I do, put like, subscribe, share. It helps. Play with the YouTube algorithm. Play with the, you know, you know, get this information out there because veterans need to know. Veterans need this education. They're not taught it when they're in the military. Most aren't taught it when they come out, and they need to know that it's okay that there is healing, there is recovery, there is a way to move on. So, like I said, if you like what I'm doing, hit the like button, subscribe, share this with your friends, share this with veterans that need to see it. If you're a therapist, share this with your colleagues. Hopefully, and if you think there's a way I could say this better, you think I'm not giving out the right information, we all leave a comment, and I will, I'll look at it and see. But other than that, you know, love your family, care for your loved ones. Stay safe out there. It's a crazy world we live in. And just remember, you can find healing if you look for it. Government Property, out.